Hello, I'm Senator Rod Grams, and welcome to the July edition of our Washington Report. Now, our country, as you know, is the envy of the world when it comes to healthcare facilities, technology, research, and healthcare workers. However, we need to address a crucial problem faced by many Americans, and that is access to affordable health insurance. Now, recently I introduced the Healthcare Accessibility and Equity Act of 1999, which is based on the premise that instead of increasing the costs of health insurance, Congress should focus on the 43 million Americans who are currently uninsured. Now, many of those who are uninsured have been treated unfairly by our tax laws, making insurance coverage too expensive and out of reach. My legislation presents us with an opportunity to create the most comprehensive, tax-deductible health coverage system in our nation's history. We'll discuss the bill, and we'll also focus on Medicare as well on today's program, and my guest is one of the Senate's authorities on health care issues. He is Assistant Senate Majority Leader Don Nickles of Oklahoma. And Senator Nickles, thank you very much. Welcome to today's program. Thanks for taking time to join us.
Happy to do it.
Talking a little bit first about the bill, the Healthcare Access and Equity Act of 1999, and you've joined in along with Senators Abraham and Roth and myself in co-sponsoring this bill. What would be some of the reasons you think this is so critical that we get a bill like this passed this year?
Well, one, I want to compliment you for your leadership in putting it together, and it's certainly needed. And you're trying to address some of the inequities in the tax code that benefit a lot of people a lot, and some people zero, and that's wrong. For example, in today, a business corporation, say General Motors, they get to deduct 100% of their health care cost. Self-employed gets to deduct, I think, 45% of their health care cost. And somebody who's not employed or works for an employer that doesn't help them with health insurance, they get zero. They have to buy all their health care with after-tax dollars. Somebody else has their employer pay all of it, and they don't have to pay taxes on any of it.
That's right.
That's not right. The tax code should be fair, and frankly, if we're going to use the tax code to help benefit people in purchasing health care, it should apply to all Americans, not just people who happen to work for nice, generous employers. So you've taken the giant step, and we've incorporated a whole lot of that in our Patients' Bill of Rights and saying, let's try and make sure the tax benefits apply to everybody. Why in the world don't we allow self-employed people to deduct 100% if we're going to allow corporations to deduct 100%? I used to be self-employed, and I used to run a corporation. And for Nickles Machine to get to deduct 100%, but Don Nickles Janitor Service gets to deduct 45%, something's wrong. That's inequitable. You've introduced legislation to fix that. I compliment you for it. And the good news about that is that you're focusing on the problem. We do have the best quality health care in the world, and you've got one of the best centers anywhere in Mayo's in your state. Fantastic facility, wonderful professionals, best health care anywhere. You have people all across the world coming into Mayo's to have treatment. So we don't want to do any harm to the system. We want to improve access to more people and get in the best health care system, and that's what your bill does by making more equitable treatment of the tax code.
And I think, you know, the old saying is first do no harm. That's an oath doctors have to take, and I think Congress should do the same, and especially when it comes to the tax laws. And why is Congress, well, I guess this is speculation, but over the years this might have even gotten gradually more out of whack, but Congress really, as you've said, has discriminated against and through unfair tax codes, not given individuals the same advantages as others. And if health care is a prime concern and an importance, we should make it easier for everybody to have the ability to afford health care coverage.
Certainly, and we know we want everybody to have good health care, but to say we're only going to give tax benefits for people who work for generous corporations and basically allowing the corporation to pay their health care expenses for them and not tax them for it, whereas compared to a single mother staying at home that needs health care just as much, she has to buy her health care with after-tax dollars. So let's just take an example of health care for a family cost, say, $5,000. Somebody works for a big corporation, they maybe pay most all of it, tax-free benefit, employee doesn't even see any of the cost, whereas somebody trying to, take care of their family and they don't have a corporation, they have to earn maybe $7,000 to pay the $5,000. It's very inequitable. You've introduced the most comprehensive legislation to fix that problem. I'm very hopeful, maybe even a little optimistic, that we'll be successful in getting that done this year.
What about MSAs? They're an important part. Now we're going to talk about your bill as well, the Patients' Bill of Rights Plus, and we can compare that to Senator Kennedy's bill, the Patients' Bill of Rights. But MSAs, medical savings account, are an important part of our bill and, of course, of your Patient's Bill of Rights Plus. Maybe to explain again, I think people are beginning to understand what medical savings accounts are, but to give a quick overview again, what they are and what the benefits to
well, one of the benefits of medical savings accounts is one of the things that we have. We call our bill the Patient's Bill of Rights Plus because we incorporate a lot of things that you have in your bill. We want to give people an opportunity to buy insurance, to become an insured, to get off of, there's 43 million Americans that are classified as uninsured. They don't have insurance. We want to help them do it, and they should get some tax benefits for doing it. Medical savings accounts would allow them to do it. They could get a benefit. They could end up, basically the way they work is most people would purchase what we call a catastrophic policy, so something to cover the really expensive things. And that's what you really need insurance for. People, unfortunately, buy insurance today, in my opinion, may be overly broad. That if you compare it to automobile insurance, when people buy automobile insurance, you buy insurance for a big collision. You don't buy insurance to change the oil, to put gasoline in. A lot of people are buying health insurance to do every little thing. I think that's a little bit of a mistake. But what medical savings accounts would do is allow somebody to buy a catastrophic policy to cover the really expensive stuff. And they might have a $2,000 or $3,000 deductible policy. And basically they self-insure the balance. And so just give you an example. I mentioned an employer might be paying $5,000 for a family. What they could do with medical savings accounts, and okay, well, go out and buy a catastrophic plan, say for $2,000. Cover all the expensive stuff. You had a heart attack, something really serious. Anything below $3,000, hey, we'll give you $3,000. We'll go ahead and spend the $5,000. $2,000 for your catastrophic plan, $3,000. You self-insure the first $3,000. You put it into your own account. You write the check. You go out and you buy the eyeglasses. You don't have to go through an insurance company to buy eyeglasses. You don't have to go through an insurance company to go see the doctor, to check on the sore throat, to handle the small things. The family is able to do it. They've got an account in there, and if they don't use it, they save it. They've got it. They can use it for something a little later. And after their account gets so big, and maybe they have more money than they need, then they can get it out. And one of the big changes is, it eliminates all this paperwork and nonsense like that, but it also, one of the really positive things, it puts the person who has this account, they own the account, and they realize that's their money. And people are a lot more frugal, they'll spend their money a lot more wisely than they would with government money or they would with employer money. And so it makes people more frugal, more attentive. How much is this going to cost, doctor? Yes, I want the dentist work done or something, and maybe their other plan didn't even cover dental work, or maybe the other plan didn't cover eyeglasses. They make the decision. Anything that's deductible medical expense, they get to control. And so to me, it puts people really in control of their own health care, and they can, if they're judicious, they can end up saving money for something in the future, and basically pay for it themselves. So I think it's a great program. It's one that we're going to greatly expand, and we're going to try and make it available for all Americans.
And again, so people don't misunderstand, but say they have the $3,000 in their account, they pay $2,000 for the catastrophic, but really the deductible then is about $3,000. So if they did go through that $3,000, that's when the catastrophic would kick in.
Absolutely.
So in other words, if they only spent $1,500 of that this year for health care, whether it's for shots or, like you said, maybe even a broken arm or something, and they have money left, they can roll that over.
Sure.
So they can buy their own eyeglasses or whatever they want out of this plan.
They can roll it. They can get some more money in. They might have $3,000, $4,000, $5,000, $6,000 in this account. It can earn interest. It's there when they need it. They know they've got it. They don't have to ask anybody's permission. They can go to any doctor they want to. They don't have to say, well, this doctor's in this plan or in this plan. I can't go here. I can't. They make all those decisions. They're in control. They've got control of their destiny, and people will like having that. And conversely, if they're getting a little older, later on they could roll that over and purchase long-term health care with it.
Right.
So that's really, I think it changes buyer behavior, but it also it's just a very positive concept of people saying, wait a minute, let's buy insurance for what we really need insurance for. I can personally pay for my kids going to the doctor for sore throat and stuff. I can't pay for cancer or for heart surgery and things like that. I can't afford it. So I need insurance for the expensive things. I really don't need to have the forms and the procedures and stuff to do the $20 expenses.
When you mentioned it would change buyer or consumer spending habits, under first dollar coverage or third party, To me, I always think of it as like a buffet. If I paid $5 for the buffet, I'm going to go back 8 times. So I eat so much that I'm sick, but to make sure I get my $5 worth.
Yeah.
And insurance is a different concept. You only insure for those things that you can't afford, but people right now think insurance is to cover every little thing. So this would change the whole concept, and it probably would not overuse the medical system that we have today.
Absolutely. And those are very positive changes. Those are market-driven changes. Because you're exactly right. When you have the system basically set up where people are thinking, wait a minute, government's paying for it. It's Medicare or Medicaid. They pay a lot of health care. Well, who cares how much it costs? My mother went in for cancer, and I asked the physician, how much is it going to cost? Oh, don't worry about it. It's Medicare.
Yeah.
You know, it doesn't make any difference. Well, if a participant is involved in it, then they will care, and they will say, well, wait a minute, is this appropriate use? At least for those smaller accounts, people will be very interested in how much things cost, and I think, again, will make people better connoisseurs of healthcare. They'll shop more. They'll make sure they're getting their money's worth because they know that's their money. And frankly, if they don't use it, if they don't spend it for healthcare, they could use it for something else. They make the decision. They control it.
And again, this doesn't shut anybody out. They still have all the access they need to all the medical care they need. They just become better shoppers, I believe.
Absolutely. And again, it gives that individual, we mentioned the people who work for the large corporations, they get good health care, that's great. And if they're happy with it, they can stay with it. But for an individual that happens to be working as a janitor someplace that has no benefit, gets nothing out of the tax code, now they're going to be able to get it. They're going to be able to deduct the cost of that catastrophic plan. They're going to be able to deduct this amount of money, the deductible amount that goes in, that they're going to be able to manage. So they're going to get a tax benefit. Frankly, right now they don't get. They get the shaft on the present tax code. Now we're going to offer some equality in the system that's going to help the uninsured. And that's the main thing that's different between our approach and maybe Senator Kennedy's approach. We're trying to really target, and particularly with your bill, we're trying to target those people who are left out, who are uninsured. What I'm afraid what his bill will do, he adds a lot of mandates. They all maybe sound kind of good. We're going to make sure these companies do this, 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 and this, and this. Government knows best. Washington, D.C. knows better than the state of Minnesota or anybody else. So we're going to mandate this long laundry list of what has to be in everybody's bill. The cost skyrockets, and the number of people who are uninsured increases by probably in the millions.
They're uninsured because they can't afford it.
Absolutely.
If everybody could afford it, they would buy it, so we need to make sure it's more affordable. Before we take a break, and I want to talk about the Kennedy Health Care Plan compared to the Patient's Bill of Rights Plus after the break, but before, along with our bill, there's also the flexibility with the MSAs, et cetera, about long-term health care. And that is, once you're retired, if you ever have to go into a nursing home or whatever, this would buy insurance, so it would make it attractive, or at least a possibility for young people to consider this, to buy the insurance while they're younger. It's cheaper, and they can plan then for it would also help in their retirement to know that those kind of costs would be covered. It wouldn't rob their estate of what they want to give to their children, etc. So that's another positive for the long-term health care.
One of the things that very few people save for is long-term health care.
That's right, because the government right now takes them on. I mean, so it's kind of where they don't have to, but everybody pays for it in taxes.
Yeah, they say, well, okay, well, maybe Medicaid will pay for it if all the money's gone, but most of us don't want to have to rely on government, and we don't want to have our kids pay for our...
Or lose our whole estate to it.
Exactly. So why not? Why not do a little planning and give some benefits? So under the medical savings accounts, for example, people can accumulate some money in the account. If they have more in there than they need for their deductible or something, they could use some of that money to purchase long-term health care insurance. So when they do get older, when they do go into a nursing home, some of those expenses are going to be paid for. They've already been planning for it. Most people don't do that. We would make that a flexible option for them to do. Don't mandate it, but at least it would be available.
Right. All right, thanks. We're going to take a break. We'll be back and talk more with our special guest, Senator Don Nickles, right after this.
The average kid doesn't get straight A's.
The average kid could live on French fries.
I could live on pizza and ice cream.
Gummy bears.
The average kid trusts their friends more than anybody.
The average kid is totally bored.
Totally bored.
The average kid has a lot more on their mind than you think.
The average kid is pretty strange.
The average kid has been offered pot.
The average kid thinks everybody else smokes it,
But the average kid doesn't.
The average kid is anything but.
Yeah! Who's the man? Yeah! All right! your birthday? Oh, it's so pretty. Oh, I told you, don't be bringing that weak stuff in here. Yeah. Who's the man? Who's the man?
Exercised lately?
And again, thanks for joining us on our Washington Report. Our special guest today is Senator Don Nickles of Oklahoma, one of the experts in the Senate when it comes to health care, and that's what we want to talk about today. We talked about some of the bills or issues that we have out, but also President Clinton outlined his vision of Medicare this week. We want to talk about that, but also it's been in the news, it's been on the floor for many weeks, and that is the comparison of the Kennedy Patients' Bill of Rights bill, which we hear so much about, but also your bill that you're supporting, that's the Patients' Bill of Rights Plus. And maybe we could talk a little bit about that and give us some compare and contrast and why Republicans feel so strongly about our bill and why we think it's better than going in the other direction, and that is the Kennedy idea, and maybe we can give some distinction to that.
Well, first I'll compliment you again. You mentioned earlier in the program, one of the things we should do is do no harm. Mm-hmm. We do have the best quality healthcare system in the world. We should be very proud of it. We should look at what works really well and try and complement that, mm-hmm. not say, well, wait a minute, we want to replace that with the government knows best. We have a different philosophy than Senator Kennedy, and I respect him greatly. He's a very strong advocate for his position. I just think his position is wrong. The net result of his position would greatly increase health care cost and therefore greatly increase the number of uninsured. Mm-hmm. His bill has a lot of things in it that to me just don't make sense. It's this idea that, wait a minute, we know the state of Minnesota has good health care, but we know better. And so no matter what you have in the state of Minnesota, and I think you have like the state legislature, the government in Minnesota has like 30-some mandates and what has to be in your health care plan. Most states do. He says, wait a minute, that's not good enough. We're going to come up with a whole laundry list and dictate what has to be in your health care plan because we don't think you can do good enough, Minnesota. Right. And I just disagree with that philosophy. And so we don't have the philosophy that the federal government knows best. He does. And as a result, it comes up with a long laundry list of mandates that are very, very expensive. And so we have that difference of philosophy. He also says, well, wait a minute, you should be able to not only sue your plan but sue the employer. And I'm afraid if you did that and sue an employer for not providing a benefit that he doesn't have to provide in the first place, a lot of employers are going to say thank you very much, but with the lawsuits and the way they're going right now, a lot of employers say, here's some money, you go out and buy your own insurance, right. I don't want to have the liability of that. And so employers would be dropping plans like crazy and the number of uninsured people would be going up. We have a different philosophy. If somebody doesn't get health care when they need it, for some reason maybe they go and everybody's beating up on HMOs and so on. But if somebody is denied care and says, wait a minute, that's not covered by our plan, or that's not medically necessary, the plan tells you that, we say in our bill, in contrast to Senator Kennedy's that says, hey, just go sue. Punitive damages, we'll teach them a lesson. We say, wait a minute, they should have an answer. They should have an immediate appeal by a physician, not by an insurance agent, not by a bureaucrat in some office, not a lawyer, but by a physician, a different physician, hadn't been working on that case, and have them review it. And if they still don't, if they're still denied, then we give them immediate appeal. And certainly if there's a health-threatening situation, it's immediate. And the appeal is done by an outside. It could be set up by the state. It could be done by a university. It could be done by an organization that to arbitrate these things that the state would select, and their decision is binding. So somebody will find out immediately, wait a minute, the insurance company said this wasn't supposed to be covered, but the doctor said, hey, it should be covered, it's covered. And that's binding. They have to, in other words, we want to make sure that people get access to care and they get the decision and they get the quality health care they need it when they need it, not 3 years later after it's too late, after fighting some big expensive battle where the lawyers make out like bandits and the patient gets very little. Nothing. And maybe it's too late for the patient anyway.
And also Kennedy's plan would shape what they would consider the perfect federal idea of a health care plan, which means that it would have to fit you no matter what you do. If you're married, you're single, you're young, you're old, you get children, you don't have children. I mean, it's a one-size-fits-all rather than allowing you the flexibility to tailor your insurance for what best meets your needs and to do it in the most cost-effective way. His would add all the mandates and all the costs, instead of giving you the freedom to do it in the way that fits you the best and fits your budget the best. So, I mean, cost is a big part here, too. And again, it's the Washington knows best. Kennedy knows better than your father or your mother or yourself or your family.
And all the state regulatory agencies, it's this people, you know what HCFA is, the Healthcare Finance Administration. They are swamped. They're not, frankly, doing a very good job right now. They're trying, but they're not. They're not complying. Senator Kennedy's passed a bill in the past called the Kennedy-Kassenbaum bill, and the states were supposed to comply with it. Some states haven't, including the state of Massachusetts, hasn't complied. Well, his bill says, well, if the state doesn't comply, the federal government's going to take over. And that's the premise of his whole bill. We don't believe in that. We kind of think, wait a minute, insurance, shouldn't the local people who know where the hospital is, who know where the doctor, the people who license the hospital, people who license the physicians, shouldn't they be the ones to be making the decisions instead of having some bureaucrat in HCFA that doesn't have the slightest idea where, they may know where Rochester, Minnesota is, but they don't know where most of the towns in Minnesota are, much less whether somebody should be qualified or should they be licensed. So that's a big difference. Plus, we put in the plus portion. We put in the tax equity portions that you've been pushing for. So everybody in America can get a tax benefit to help them buy insurance. We've got a lot of uninsured people, about 43 million. Shouldn't we be helping them? We shouldn't just be driving up the cost on the people who have health care, most of whom are quite happy with the health care that they have. We shouldn't just be jacking up their premiums and putting their health care at risk. We should be expanding access and coverage to all Americans. That's what you're trying to do. That's what we're trying to do in our bill.
Looking in another area, Medicare, you know, early or late in June, the President outlined his vision of Medicare reform. Just kind of your ideas on what the President outlined, and specifically talk about the issue of prescription drugs.
Well, I've been very disappointed that the President didn't come forward. As you know, we need to save Medicare, and all of us on the Republican side are very committed to doing it. Medicare has a big demographic problem, a big challenge. We've got a lot of baby boomers that have been hitting...
Social Security. It's
like Social Security, and if you just look at the number of people who will be drawing benefits about 10, 12, 15 years from now, that number rises rather dramatically. And the forecasts are there's not near enough money going into the system, in spite of the fact that President Clinton increased Medicare taxes dramatically back in 1993.
Right. People don't realize that.
I realize it, and I think most taxpayers realize it. So he had a big tax increase, but the forecast still, in about 12 years, we've got a real problem. More money, a lot more money is going to be going out than coming into the Medicare system, so we have to save it. What did he do? We put together in Congress, we know this problem's here, we put together a bipartisan task force, people appointed by Congress and by the President to help work up a solution. They came up with good proposals. The President, unfortunately, walked away from that. And we had Democrats and Republicans saying, here's a good outline on how we can save Medicare, and the President basically just walked away, said no way.
That's right.
And now he comes in last week and says, hey, I've got a new program. We want to add prescription drugs, a drug benefit, frankly, that's not near as good. 2/3 of seniors on Medicare right now have prescription drugs, many of whom have a much better drug proposal than what he came up with. And he said, we don't care if you like what you've got or not. We're going to replace it with government knows best.
Plus, we're going to increase your premiums.
And we're going to more than double your premiums. He said, well, let's add another $24 a month now, and then in a few years it'll be $44 a month for the privilege of you paying for a program that you didn't, maybe not as good as the one that you have right now.
Right.
So I have serious problems with that. In contrast, what should we do? There's 1/3 of seniors, Medicare recipients, that don't have prescription drugs. Many of them can't afford it. Many of them didn't work for the employer that helped subsidize it. They can't afford a Medigap policy. Let's try and help those that can't afford it. Let's see what we can do. Let's come up with Medicare reforms that would bring Medicare back from the 60s, kind of an antiquated government plan that doesn't offer choice and competition. Let's update Medicare, give seniors more choices, including medical savings accounts and some other options, and we can bring about efficiency. We can save money, and in the process do what the private sector is doing and offer prescription drugs. Where you have competition, you'll notice if somebody can choose from a dozen different plans, some of those plans have prescription drugs. Competition works. People are able to say, hey, we can make this work. We should make that available for seniors and try and make that happen and provide for some assistance so people can have some prescription drugs that are on the bottom end of the economic ladder. But we shouldn't be taking people that are happy with their policies and say, nope, we don't care, that's not good enough, we're going to replace it with a plan that we know is best. I think that'd be a mistake.
The President also is going to control costs by, again, reducing the amount that they're going to pay providers, which is going to reduce health care quality, I believe. But also he's taking money from the general fund, nearly $800 billion. Now we're taking money not from a dedicated program like Medicare, which is deducted in your taxes, but we're going to dip into the big general fund to make up the difference. Now this is a big change in the way we finance Social Security and Medicare.
Oh, and you're exactly right, and I'm very troubled by it, because you pay, and your employer pays, anybody that has a payroll is paying 1.45% of their payroll tax to Medicare. With their employer matching that, that's 2.9%. Used to be on the Social Security base, now it's on all income.
All income.
That is a lot. That's a big tax increase. Michael Jordan's paying a whole lot of Medicare taxes right now.
About $1 million a year?
At least, at least. So my point being, for him to now say, okay, well, we're going to add this brand new benefit, expensive new benefit, and how are we going to pay for it? Well, we're just going to dip into your income taxes, corporate income taxes. That's how we're going to pay for it. Oh, we're just going to take a percentage of the surplus. It sounds kind of innocuous, but really what he's saying, we're going to take your income taxes.
That's right.
So this payroll tax is not enough. And that means I always look at things kind of from my son's eyes. He's 29 years old. He has one child. He's working. His wife is a teacher. And I'm thinking, he's already paying a whole lot of Medicare tax. Now they're saying, and he pays a lot of income tax too. He's basically saying, young Nickles, you put in some more money. This is not enough. And kind of like no end to it. Oh, we just reach over more from the general fund to pay for this program. And he's coming in, he's starting out with a program like, oh, it won't cost very much. The way he's designed this thing, the cost will explode and probably bankrupt the system. It'd be grossly irresponsible for us to do it in the way that he's proposed.
All right, we have to take a quick break. We'll be back and talk a little bit more with the Senator from Oklahoma after this.
Over 2 million acres of our wildlands burn each year, and hundreds of homes are lost as a result.
At least 50 homes were burned to the ground. Dozens more were damaged as fires raced through dense brush and steep canyons.
Flames don't know the difference between forest, rangelands, and homes. Learn how you can fireproof your home. For more information, contact your local fire protection agency, state forestry office, or the USDA Forest Service.
And again, thank you for joining us for a Washington Report. We have about 45 seconds left talking with Senator Don Nickles of Oklahoma, Assistant Majority Leader in the Senate. Don, thanks for being here. Just a quick question. Are we going to get tax relief in this Congress, and is it going to be meaningful?
Absolutely. We're going to have good tax relief this year. We're going to do tax relief, I think, targeted towards middle-income people, particularly people that are paying, a 28% tax bracket. Hopefully we'll do something to eliminate the marriage penalty, maybe reduce capital gains and estate taxes, but I think we're going to pass a good tax reduction bill this year.
Okay. Well, Don, thanks again for joining us. Really appreciate your time. Thank you for joining us for our Washington Report. We'll be back, of course, next month with a new program, but again, thanks for joining us. Senator Nickles, my pleasure. Thank you. We'll see you next month. Thank you.